All right, everyone, let's dive into one of the two different systems that you're going to see with the autonomic nervous system. And of course, this one is a big one. It's the sympathetic system. So the sympathetic system is going to speed things up. Remember our fight, flight, freeze, and reproduction, right? And so it's going to do everything it can to make sure that if you're running from that tiger, you can do it. So the big thing to know is anatomically, it's going to come from this thoracolumbar outflow. Now, we have the entire spinal cord right here, our cervical, our thoracic, our lumbar, and sacral regions. But really, the sympathetics only really come out of this area here. And if that's the case, it's got to get all over the place, right? I mean, think about everything that happens in your body, sympathetics, or even on your skin, right? You sweat. The bottom of your feet sweat, you have erector pilation, goosebumps all over your body. This is all from sympathetics. So if they only come out from this thoracolumbar area, they have to find a way to get everywhere else. And that's the sympathetic chain ganglion, also called the paravertebral ganglions. And so this right here is our elevator. And you can see it goes all the way up to almost to, our head, and it goes all the way down and fuses together as something called the coccygeal ganglia. Now, it used to be called the sacral impars as well. So if you're looking through things, you'll see sacral impars and maybe coccygeal ganglion. We're going to talk about on the next slide the 4 different ways it can get all over the place. But first, let's back up and talk about the neurotransmitters. So the neurotransmitters in the preganglionic fibers, and remember these preganglionic fibers are really short, are going to be acetylcholine, right? And then it's going to synapse, and everything after that is usually norepinephrine. Now, there is hormonal epinephrine that's floating around there, but everything from the nerves, or mostly from the nerves, are going to be norepinephrine, which are going to speed everything up. Like I said, they have short preganglionic fibers, usually. We'll talk about the exceptions here. And a lot of them are going to synapse here in that sympathetic chain ganglion, but some of them are going to bull right on through and go to plexi that are around big arteries that end up going to organs. Just to back up to, we talked about the sacral impars here. These 3 ganglion up here in the neck can be important for different reasons. We have an inferior ganglion, also called the stellate ganglion, because it looks like a star, the middle cervical ganglion, and the superior cervical ganglion. Now, the superior cervical ganglion is pretty large in most people. It can be implicated in things like Horner syndrome, which is characterized by ptosis, which is drooping of the eyelid, miosis, which is a pupil constriction, and then anhidrosis, which is absence of sweating on that side. Now, the stellate ganglion, or the inferior cervical ganglion, could lead to issues with pain, problems with flushing in the arm. Usually this used to be called RSD, but now it's called CRIPS, Complex Regional Pain Syndrome. So how in the world does sympathetics get anywhere? So it's got to come out of the thoracolumbar area here in this little part called the intermediolateral horn. Once it comes out of that, it's going to flow down the ventral horn, through that ventral root, and then it's going to go onto the spinal nerve. And that spinal nerve is part of the reason why this is so entirely short, is because right after that spinal nerve comes out, there's the paravertebral ganglion that we have to jump on. And so we're going to do this via the white ramus communicans. All right. Now, this is heavily myelinated, so we call it the white ramus here. And then it's got a couple of options. And these are the 4 options I was talking about earlier. It can either synapse at this level and then go out the gray ramus communicans and then do its job. It can then go dorsal rami, ventral rami, anterior ramus, if you want to call it that, and do its job wherever it needs to. Or it can come out and go all the way up and synapse and then do its job. A lot of times what will happen, especially if it's at the superior cervical ganglion here, you're going to see a synapse, and then you're going to have these little fibers come out. And those little fibers are going to then wrap around arteries and get to wherever they need to go. All right. Or it can go all the way down to the sacral impars areas, and that's where you're going to see everything going to like your bladder all the way down to your feet. Then the last thing that it can do is, instead of jumping on the gray ramus or even coming out like that, instead of synapsing in this area, it's going to pop right out and form nerves called the splanchnic nerves. Now, you may have heard this in gross anatomy before, but the greater, the lesser, and the least thoracic splanchnic nerves are some of these that come out. And so let's look at the greater thoracic splanchnic nerve. It's going to pop out of this ganglion, not having synapsed, and then it's going to go around ganglion that are around the celiac trunk. And they're going to synapse there and then work their way to the organs that they need to from there. Now, how does it do work? So our sympathetics have to use a bunch of different receptors here. And I'm going to defer to Dr. Lori McCory, a pharmacist out of Bay State College, who produced this article in the American Journal of Pharmaceutical Education in 2007. And so I'm going to try to consolidate this down as much as I can, where we see two main types of receptors, alpha and beta. Alpha are usually in arteries. That goes together pretty well, right? And so the thing that it's going to do is it's going to end up vasoconstricting some arteries and vasodilating other ones, right? And so we're going to shunt blood from our internal organs to our muscles because that's what we need in order to run. So it's going to vasoconstrict those things in our internal organs. And we see this here quite a bit. Our abdominal viscera, kidneys, skin, it's going to really constrict that and shunt that blood to the things that it needs to go to. And then we have beta. Now, beta is breaks and beats, right? And so they're mostly found in heart, smooth muscle, glands. And so in the heart, it's going to speed up your heart rate, increase that contractility of your heart. In your intestines, it's going to stop motility. So it's going to stop things moving through because we just don't need it at that moment. Right? And the same thing's for your sphincters. It's going to constrict those internal sphincters right there because, again, we don't need the motility as it goes through. So that's a really quick crash course on the sympathetic nervous system, part of the autonomic nervous system. Let me know if you have any questions in the comments.